But we would be wrong to assume that all science in the area of pandemic management is absolute and lends itself to a singular plan. It is not. With COVID, there is too much uncertainty, so every country has had to forge their own direction. In crafting a plan for New Zealand, we've very openly sought and received advice, had it contested publicly by other experts in the field, and ultimately made decisions that we believe have been in the best interests of New Zealand, both for our people and for our economy. You can see that from the forum today, that continues to be our approach. Today, our goal is twofold. Firstly, to set out the evidence that is emerging as countries around the world grapple with Delta and the next phase of the pandemic. And secondly, to lay out the path ahead for the next 6 months. And that's what I'll endeavour to do now, using all of the evidence and advice you've heard. Just like the science, that path will not be absolute, but I think people have come to appreciate that while the future is uncertain and the plan can change, that doesn't mean we can't make one. In shaping that plan, you'll have heard a strong theme in the evidence laid before us, the curveball that is variance. This is exemplified by Delta, and you can see on the slide in front of you countries who early on in their vaccination programs and who often we may have emulated or seen to be similar to, that have had transmission under control before Delta. I recall in a meeting recently Professor Skegg laying out the difference between Delta and the early iterations of COVID-19. And you can see that in the way it's behaved in Australia and beyond. Delta is a game changer in our risk calculation. It could be devastating if it took hold in New Zealand before we have high rates of vaccination. Evidence from China suggests that with the Delta variant, the time interval between when a person picks up the virus and when they become infectious themselves is significantly shorter. That is up to 3 times more infectious, meaning that one case is now on average passing it on to 9 others. What comes through in the evidence and what you'll have heard today is that Delta may be the variant of the day, but it may not necessarily be the only one. We all remember when the variant from the UK emerged, then Brazil. There will be more. The hope, of course, is that a vaccine will remain successful against whatever comes our way, but there are things we can do to make sure that no matter what happens in the short term, we retain as many options as possible as this pandemic continues to alter and change. That brings me to what it is about our approach thus far that has been the most beneficial to us. Our goal from the outset has been to save lives, and we did. We did so also believing that by reducing down as much as possible the impact on human health, we'd have the best possible chance of reducing the impact on our economy. And you can see some of the markers of that here today. That has proven to be true. Our economy has returned now to pre-COVID levels. Unemployment is incredibly low. We've outperformed most of the countries we compare ourselves to. And while there are ongoing challenges, we've largely avoided long periods of lockdown, having sick workers or many businesses being closed for good. While it has been extraordinarily hard, I am proud of what we achieved in the way in which government and business responded in this unprecedented challenge. That is not to say the response has been without cost. The impact of border closures has been very tough. It has impacted on loved ones, family and friends being separated, industries accessing skilled employment, or Kiwis just missing that personal sense of connection. It's just one of the reasons that I believe that this year has felt so hard. In 2020, we knew what we had to do. In 2021, we want to know that things will get back to normal eventually. And herein lies our competing challenges. How do we maintain the elements of our approach that have looked after people's health, made day-to-day life, for the most part, pretty normal, while reducing some of the friction at our border? To achieve that, it's the view of Cabinet that for the next period of the pandemic, that means maintaining our elimination or stamp it out strategy. While the pandemic continues to rage overseas and the virus continues to change and mutate, the best thing we can do is lock in the gains achieved to date while keeping our options open and giving ourselves choices. And a careful approach that says there won't be 0 cases, but when there is one in the community, we crush it, is the best way to maintain our normal lives while we monitor the twists and turns of COVID-19 over the next 6 months. One of the risks we all face currently is that in an environment where we have partially vaccinated populations, a variant that is more dangerous and vaccine resistant may well emerge, and you've heard that today. Now, we all hope that won't happen, but if we choose to change our strategy too early and we see an even more problematic version of COVID emerge, there is no going back. Ultimately, our response to COVID so far means we have more choices than many countries as we enter the next phase, and our plan needs to take account of that and our desire not to go backwards from where we are. So, principle number one will remain maintaining our elimination strategy to stamp out the virus so we can maintain our hard-won gains and keep our options open. That is not to say that the settings we have today will be the settings that we have forever. I've previously said that the border has acted like a collective armour for New Zealand, protecting us against the virus. The trick with vaccination is to move to each of us having individual armour, and meaning we need to rely less, or at least not only, on border settings. Vaccines are the game changer in this pandemic, but for them to be successful, we need as many people as possible to be vaccinated. When it comes to our vaccine rollout, we are now significantly ramping up as a result of having the access to supply that we needed in order to ramp up our program. The past few weeks have seen us reach important milestones with over 2 million doses delivered, and surveys shown that reluctance perhaps previously from some members of the population who may have needed more information, that is declining. We're now hitting around 45,000 vaccinations a day, just shy of our goal of 50,000 a day that we set for the September-October period, but with more and more vaccination sites starting up each day. In total, 848,406 people are now fully vaccinated. That's probably changed in the last hour or so, and a further 1,444,895 have had their first dose. And we're on track for everyone in New Zealand who wants a vaccine to be offered one by the end of the year. And we have an excellent vaccine. Pfizer consistently is leading the pack with very high rates of effectiveness. You recall that when we started our rollout, we were asked whether we would prioritise first doses and push out second doses, as some countries had done. We decided against that strategy. We wanted people to be fully vaccinated quickly, and for two reasons. The first was because those people we prioritised first were at the greatest risk. They were our border workers, our health workers, our older people. They were our first line of defence and those most at risk if the first line of defence failed. The second reason we decided against a spread dose strategy was because the clinical trials at that time were based on 21 days between doses. Three things have changed since that decision. Number one, we've rolled out the vaccination program to those most at risk. Number two, a small number of studies over the past few months suggests a marginally greater immune response with a slightly longer delay between doses. And thirdly, Delta. Should we experience an outbreak, data shows that one shot of Pfizer can be as significant or is estimated to reduce hospitalisation by up to 71%. So as a population, we are safer if we have a larger amount of people at least partially vaccinated than we are if we have entire groups unvaccinated. The New South Wales outbreak highlights the risk of a Delta outbreak, and Professor Skegg's report is clear on the need to do all we can to keep it out. So while the first step in our plan to reopen our borders has always been achieving high rates of vaccination, we're now taking steps to speed that up. As such, we as a government have decided to accelerate the reach of our rollout by changing the booking system so that it will default to a 6-week gap between doses rather than 21 days. We also aren't requiring or asking or even suggesting that anyone currently booked in make a change to their second booking. This is about a change going forward for those who have not yet booked their vaccination. To be clear, though, those who wish to have a shorter gap can still do so. And if someone is vulnerable, we still recommend being fully vaccinated as soon as possible. That's why there will be an option to have a shorter gap on the website when booking. But from a population basis, It makes sense to get as many New Zealanders at least partially vaccinated quickly. It's a small change, but with some win-win benefits. This change will make more booking capacity available, which means we'll be able to move through our age bands more quickly than previously signalled. As you know, those who are aged 50 plus will be invited to book from tomorrow, Friday the 13th of August. From there, we'll now be able to open up to a wider age band, inviting those aged 40 plus to book their vaccine next week, from Wednesday the 18th of August. And a week later, on Wednesday the 25th of August, we'll be opening up to those aged 30 and over. From 1 September, just a few weeks away, we will be open for all eligible ages. All going to plan, that should mean our entire population has had the opportunity to book a vaccination through September and their second one by December. That then is principle 2 of our strategy going forward, ensuring every eligible New Zealander is offered the opportunity to be vaccinated as soon as possible, because that is our best defence against Delta lockdowns and opens up a world of opportunity. And as you can see, our plan has us doing just that. Many have called for a definitive number or a percentage of the population that needs to be vaccinated before we start altering the phases we are in. Experts have advised against that. You've heard that from them today. We want as many people as possible to be vaccinated. But just as important is the fact that a single percentage doesn't tell us enough. I can share with you the markers, though, for good vaccine coverage that we will be looking for. 1, we're looking particularly to make sure we have good regional spread of vaccinations, so we don't have large pockets of unvaccinated people in parts of the country. 2, we also want to see high vaccination rates in high-risk populations. Older New Zealanders, immune-compromised, those with comorbidities, to ensure the most vulnerable in the population are well protected. And yes, we will be looking explicitly at our reach into Māori and Pacific populations to ensure that we've enabled access to the vaccine in those communities too. 3, younger adults have been identified as strong sources of transmission, so uptake there matters, as does overall coverage across age groups, who tend to mingle with one another and can therefore be areas of weakness if we have large proportions that are unvaccinated. These will be the data points that we will be looking at. That then brings me to principle 3, reducing the need for further lockdowns as much as possible by continuing to strengthen our health and contact tracing systems. Vaccination gives us the best opportunity to do that, but the next 6 months will be critical. Not only do we need good vaccine uptake to break chains of transmission if they start, we also need to continue to be vigilant. And if a case does come in the meantime, we'll continue to take the short, sharp approach that has served us so well. As we flagged earlier this week, if it's Delta, that could well mean a short, sharp level 4 to prevent a long, drawn-out level 3. We must learn from the experience of others. But if everyone heeds the call to be vaccinated by the end of 2021, it is our goal to reduce and then eventually, as much as we're able, remove the need for lockdowns. Instead, we hope to be in a position to take what has sometimes been called and described here today, more of a measles approach to COVID-19. Many may have previously not known that the use of contact tracing and isolation is not new in New Zealand. Measles is both incredibly infectious but also potentially deadly for a young unvaccinated child. When we have outbreaks in New Zealand, we contact trace, we isolate. And these are the public health tools that in the absence of lockdowns, we will absolutely continue to use. And that means being prepared for that. So, principle 4, maintaining strong public health tools. But if we are to maintain a stamp it out strategy and we want to avoid lockdowns, that means trying to reduce how many cases we might need to deal with. And that brings me to our greatest challenge, the border. We cannot keep border restrictions on forever, and to be absolutely clear, we don't want to do that either, and neither do the experts we talk to. Border closures were only ever a temporary measure in order to keep COVID out before a vaccine was developed and administered. So long as the scientific evidence shows we can safely transition from a border defence to the individual armour of the vaccine, then that is the direction we will go. But once we are vaccinated, this will need to be a phased approach for 2 reasons. Firstly, While vaccination is ramping up locally, it is clear that the global vaccination effort will continue into 2022 and beyond. There will be large areas of the globe that will remain unvaccinated for some time, especially Africa, parts of Asia, South America, where vaccination rates are far behind those of the West. And we will continue to play our role in supporting vaccination through donation in those areas as much as we can. The second reason is that, as we all know all too well, a vaccinated person can still unfortunately pick up COVID. In Canada, for instance, they've started testing at their borders to try and reduce quarantine requirements. Of the 17,000 vaccinated Canadians coming through, 8 have had COVID. Now, that is a very small proportion, but if you think about it in terms of the previous level of visitors New Zealand had pre-COVID, that's the equivalent of every week 35 cases coming through our border, even if every single traveller was vaccinated. As Professor Skegg pointed out earlier, even if we had the same success as the UK with vaccination uptake, if we also adopted the rest of their settings, we could experience the equivalent of 48 deaths a week from COVID, nearly double the number we had in the entire pandemic today. That is not to say we'll keep our border settings as they are into the never never, but it is a good reason to be careful and not to move too soon and put at risk all the gains that we've made. Our plan instead is to follow the advice and keep our settings as they are while we vaccinate, but phase our reopening once we have good coverage in the new year. I don't propose that we sit back and wait, though. A phased reopening requires work, and that work has already started in 2 parts. First, how we're preparing to approach the border in the new year, and secondly, what tools and preparation we'll need to make this approach work. As a first step, from next year, once everyone who is eligible is offered a vaccine and we have good coverage through the criteria I just described, we'll move to a risk-based pathway system of travel. That means the nature of your entry into New Zealand will be dependent on a couple of key things, in particular your vaccination status and where you have been for the last 14 days. Countries will be grouped according to risk. Factors considered will be the number of cases, prevalence of variants of concern, vaccination rates, and our confidence in the country's strategies for maintaining outbreaks. We have started already with our approach to very high-risk countries, and we have a framework that we've established as part of that assessment, but this will be broadened. Alongside vaccination status, the risk of the country will play a big part in determining the pathway for arrival into New Zealand. We're already pretty well equipped to manage pathways 1 and 3. We've been doing these for a while and have the systems in place. But even for those pathways, there will be opportunities and priorities. Cabinet has agreed to prioritise the development of the Traveller Health Declaration system to confirm vaccination status and rapid border testing to increase our testing options. This reduces risk and makes it a lot easier for the traveller. On rapid testing, as per the advice from the advisory group chaired by Professor Skegg, we're setting up a COVID-19 testing technical advisory group to provide independent advice to the Director General of Health. Their focus will be on testing technologies, approaches and feasibility to make sure our work is even better informed by the latest and best developments in testing. On Travel Health Declaration, we're establishing a system to confirm a traveller's vaccination status. A digital tool is being developed by border agencies to help assess the level of risk of travellers to and from New Zealand. This is a Traveller Health Declaration system and will require travellers to upload information before they arrive in New Zealand, such as their vaccination information. This will be both for New Zealanders going overseas, as well as people coming into the country. In the short term, a manual solution will be developed to allow passengers to arrive in New Zealand when border settings are ready. In the future, this will be a fully digital platform that will simplify the traveller experience, and Health is already doing excellent work to lay the groundwork for this process. In addition, Customs, the Ministry of Health, Ministry of Transport and other government agencies are kicking off a new work program with airports and airlines over the next 8 weeks to develop options for how to support a safe and smart reopening of our air border, similar to the work they did together to prepare for quarantine-free travel with Australia. The group will focus on the pre-travel, en route, arrival and domestic stages of the overall travel and border process. The outcome will include information and options to inform government decisions on how the system might be operationalised in a way that is safe, streamlined and as coordinated as possible. There is a wealth of knowledge and experience across government agencies and industry partners in the aviation sector Bringing together this expertise will help inform government decisions on operational solutions for the next steps of our reopening. Pathway 2 will be new. It is our opportunity to change our border settings, freeing up space in MIQ, providing a way for more people to enter the country. Here, instead of 14 days of MIQ, we'll be looking at what we're broadly calling modified isolation. That means if you've been to a country where there is COVID, but pretty decent rates of vaccination, and you yourself are vaccinated, rather than going into MIQ in the standard way we do now, we'll be looking into either isolation at home and or shortened isolation periods. As you can see, there are a range of possibilities here, and to decide what they look like, we need more information, and we're starting to gather that now. As part of this, we'll be changing up the testing regime at MIQ so we collect a test at day 5. We're also going to start collecting data on vaccine status. This will help us to see whether those who are vaccinated and have COVID can accurately be picked up in a shorter window. If we get information that tells us that cases are coming through in that early period, that gives us extra confidence around reducing isolation periods in Q1 next year. Because vaccinated people also pose less risk, we want to consider the possibility of home-based isolation. So a lot of work is required to make this successful. Our public health advisors have told us that they definitely don't suggest we run this at a general level until next year, but we have proposed to them a tightly run pilot with vaccinated travellers only to prepare our systems. This will take place in October through December this year, and will take a limited number of participants to ensure it's done safely. And to give you a guide of what our view is on limited, we're talking hundreds, not thousands. This trial will enable us to test the logistics of entry into New Zealand under a self-quarantine model, the ability to monitor or enforce compliance. So, for instance, whether or not a Home D bracelet on Rob Fife is really the way to go, although by the sounds of it, maybe Professor Skeggs and IRD might want to explore these. And the management of COVID cases if they arise. This will be available to groups of people who meet a very tight set of criteria. New Zealand citizens and permanent residents who are fully vaccinated in New Zealand and have made a short trip away from New Zealand, travelling to an approved list of countries. They'll have to supply a self-quarantine plan as part of their application that meets the Ministry of Health's requirements. We'll confirm specific details of these trials in September, including establishing an expression of interest process. And it's our intention to work through employers who need employees to travel for work for this pilot. So as you can see, we will be tightly managing it. The reason for this is the extra assurance that having an employer involved with a bit of skin in the game will provide. So that sums up our 5th principle and our 3rd phase, to develop new ways to enable people to travel safely to and from New Zealand by progressively easing border restrictions, beginning in that first quarter of the new year with changes based on country of origin and vaccine status. Our ultimate goal is to get to quarantine-free travel for all vaccinated travellers. And what you can see from today is our direction and that our ambition is clear. And this sets out is a summary of all of the detail that we've shared with you today about our phases and what we'll be looking for in order to move through them. But simply, as you've heard from today, we're not in a position to fully reopen just yet. When we move, we will be careful and deliberate because we want to move with confidence and with as much certainty as is possible. Rushing could see us in the situation many other countries are finding themselves in, where after sustained periods of case numbers falling due to vaccination, they're finding them rise again after relaxing their settings and opening their borders. So our plan is to reopen in a phased way, where we assess and check before we take each step. While COVID keeps changing, we must keep changing too. But the work being done now puts us in the best possible position to use every tool we have to replace the 2 things that are causing the greatest challenges: lockdowns and quarantine at the border. I want to finish with a sentiment that Professor Skeggs shared with me a little while back that's really stuck with me. He said, just after 9/11, the border will never be the same again after COVID. point he was making was that things can change, but that doesn't mean we can't adapt to them in a way that eventually feels normal again. Vaccines, border testing, monitoring of symptoms when you travel will eventually become our baseline, and we will get used to it. Our goal as New Zealanders is to get to that place as quickly as we can with as little health and economic disruption as we can.